Oh, thanks. Thanks again, Sam. I trust you're hearing me now.
Yes, perfectly.
Wonderful. All our panelists online? All our participants, those will be taking part in the program?
So far, we have...
So good. Okay, wonderful. Well, let's get rolling. Let's get rolling. Good evening again. On behalf of the Caribbean College of Family Physicians Jamaican chapter, I want to welcome all our participants, all our panelists, our sponsors, and everybody taking part in this webinar this evening, entitled Electronic Record Keeping and its impact on our practice. I suppose I know that our sponsors will be going into that. I know that all our presenters will be going into that. I know there'll be an ethical aspect of it that will be discussed. So without further ado, I would like to invite the president of the Caribbean chapter, Professor Marvin Reed, to offer prayers for us. Please, Marvin, please unmute and go right ahead, sir.
Thank you, Dean. Welcome, colleagues. Certainly on behalf of the Caribbean College of Family Physicians, we're quite happy to be hosting you this evening. It is my duty and honor to open the proceedings with a word of prayer. I'll be using a prayer for the physicians. And so let us pray. Almighty God, you have created the human body and infinite wisdom. In your eternal providence, you have chosen me to over life and health of your creatures. Inspire me with love for my art and for your creatures. Do not allow thirst for profit, ambition for renown and admiration to interfere with my profession. For these are the enemies of truth and can lead me astray in the great task of attending to the welfare of your creatures. May no strange thought divert my attention at the bedside of the sick or disturb my mind in its silent labors. Grant that my patients may have confidence in me and in my art and follow my directions and my counsel. When those who are wiser than I wish to instruct me, let my soul gratefully follow their guidance, for the vast is the extent of our art. May our deliberations this evening be fruitful, engaging, and pleasing in your sight, and may all who are participating be blessed. For these mercies, we honor you and give thanks in Jesus' name. Amen.
Thank you, Prof. Reed. Thank you so much for offering prayers on our behalf. I will now invite the president of the Jamaican chapter, Dr. Seni Onanuja, to do the welcome and greetings. Dr. Onanuja, please unmute and go right ahead.
Okay. 2 minutes, okay. Good evening, everyone.
Good evening, Sunny.
Specially invited guests, Avanish, Saxina, Dr. Kino Francis, Mr. Trevor from Forest, and Mr. Chukwemeka Cameron. Moderator, Dr. Dan Levy, Professor Marvin Reed, esteemed colleagues, our sponsors, Pharma Online Limited, Daisy Health, and Indus Life Sciences, our host and IT support personnel, Mr. Samuel Heron, CCFP Secretariat headed by our administrator, Lynn Hyatt Thompson. Friends, ladies and gentlemen, a pleasant good evening. It is indeed my pleasure and honor on behalf of the Caribbean College of Family Physicians to bring you greetings and welcome you to this evening's webinar on electronic record keeping. Telemedicine and ethics, where as healthcare practitioners, we seek to navigate this virtual space utilizing the above mentioned tools. Telehealth has been making its mark on the healthcare community for decades. Today, over 90% of healthcare executives say their organizations are developing or have already developed a telehealth application. This is a recent development made possible by years of technological innovation. There are many milestones throughout history that have paved the way for what we consider today as modern-day telemedicine. Among these milestones of noteworthy mention are, in 1948, the first radiological images were sent via telephone. In 1959, the University of Nebraska used telemedicine to transmit neurological examinations. In the 1960s, the Nebraska University Department of Psychology Institute used closed-circuit TV for psychiatric consultations. The 1990s saw the birth of the internet, and with its birth came the real big push towards telemedicine on a large scale. Its evolution has been ongoing since then, and its use has increased significantly worldwide, especially since the advent of COVID-19 pandemic. Locally, our very own Dr. Wilson Davidson has been a pioneer and an advocate in the introduction and promotion of telemedicine services for over 20 years. Long gone are the days when the sole role of a physician was to find optimal care for his or her patients, where the study and practice of medicine was the primary concern. Today, as doctors, we are not only called to be knowledgeable, applicable, and empathic physicians, but we are also expected to be good businessmen and women. Indeed, the art of medicine is now married inseparably with the business of medicine. One has to keep a good record of not only one's income, but also one's expenditure. The advent of the information age, the so-called digital age, has without a doubt made our lives in some ways easier, but it has also impressed upon us to keep abreast with the ever-changing times. Whether we take a hand-on approach to our record management or go the route of outsourcing, we owe to ourselves and those we serve to be aware of the available options, its advantages, and its limitations. All these have to be accomplished within the appropriate legal framework. It is against this backdrop that the college organized this webinar on electronic record keeping and telemedicine, along with their ethical considerations. As such, we have a lineup of presenters from the medical, legal, and technological arena to give us some insight and guide us on matters such as privacy and confidentiality of patients' records. Also, some of our sponsors will showcase some of the tools we can use to achieve these objectives. I kindly invite you to sit back and enjoy the presentations, and thank you, and God bless.
Thank you, Dr. Ananuja. That was extremely well done. I now move right into the first part of our presentations, noting that we presently have somewhere above 450 participants. Where would we ever be able to have this amount of participants if we're not virtual? Things have certainly changed, and for the better, I think. Our sponsors, Pharma Online Daisy Health, will now do a sponsors product highlight, and Mr. Garth Russell will take this aspect of the presentation. I will now invite Garth. Please unmute Garth and take it away, sir.
Thank you very much, Dr. Levy, and good evening, everyone. It's indeed a pleasure to be here this evening with so many practitioners. As Dr. Levy just said, had we been given the opportunity to meet face to face, I'm sure that our numbers would not be this large. And we're recognizing now that indeed technology is in fact a benefit to all of us. Dr. Nanuja mentioned that as practitioners, the patient care is definitely still #1 priority, but doctors are now being called on to be good business persons. Now, this evening, I'm going to play for you a video. I'm going to pause intermittently so that I can explain what is happening in this video and speak a little bit about Daisy Health Technology. At the end of which I will introduce to you our CEO, who will speak about the security of the program or the platform. My volume is low.
So according to the poll, most persons are hearing you quite fine. And I guess if you're low, some persons will try and turn up their speakers. So you should be good.
Okay. So just allow me to open my, or to share, to start sharing.
All right, I stopped it for a second there. Can you hear me, Mr. Russell?
Okay, I can hear you then.
All right, so when you click on share screen button, right? What I want you to do for me, I want you to share your entire screen. Sorry, just the section that you're going to be sharing. Apologies. I just want you to share the PowerPoint itself or the video itself. What's happening is when you share a screen like that, as you did before, it shows like a chat window and stuff like that, kind of blocking out certain sections. So
all right, so
I might not be seeing it.
All right, so I'm going to change it now.
No problem. Thank you.
All right. All right, so when a patient enters the doctor's office for the first time, the doctor or the receptionist will give the patient a form to fill out. This form connects the basic information for the patient: date of birth, name, phone number, information that is needed by the company to ensure that the patient is properly dealt with. And if there should be any issues with the patient's card, a card can be reissued. Now, this can only be done at the doctor's office. This is what we call enrolling. Once the patient has been enrolled, anytime the patient comes back to the doctor's office, the patient simply hands the card to the receptionist, who will swipe the card. The patient's biodata appears on the screen for the receptionist. The receptionist will then send this patient into the queue for the nurse, who will receive this patient, take the patient to the room to do the vitals. Once these results are ready, the nurse will enter the vitals into the system and will take the patient, will send the patient to the queue again, the doctor's queue this time. Now, let's say that the patient was referred to the lab for a lab test or a radiology examination. This information, once the lab results are ready, will be uploaded into the system, onto the patient's file, and the doctor now will have this information so that a good discussion can be had with the patient. So no longer will the doctor or the patient have to wait for the results to be picked up by the patient or to be taken to the doctor by a bearer or sent to the physician through emails. It is uploaded onto the patient's file immediately. The doctor and the patient gets notified that the results are ready for that patient. Even vaccinations, past vaccinations and present vaccinations can be added to the patient's file through this particular system, the DAISY Health system. The physician prepares the prescription for the patient. Now, normally a prescription is written and handed to the patient, and many things can happen to that written prescription. But the prescription is created on the system, and the patient walks with the card to the pharmacy and hands the card to the pharmacist. Once the pharmacist swipes the card, the information, that is the prescription information for the patient, will appear on the pharmacist's screen, and the pharmacist can now fill the prescription for the patient. An added benefit to the program, and it's going to be rolled out soon, is that in some supermarkets, when the patient uses the card at the pharmacy, they will earn points, right? So I think it's 20% of the value of the prescription that they will earn, and that goes back onto the card as points. And these points can be used within the pharmacy to fill prescriptions again, or to purchase other things in the pharmacy. We're rolling out, as I said before, where the patients can also go to the supermarket and use those points to purchase goods from the supermarket. Also, in the doctor's offices, we're hoping to roll out a program where the patients can use those same points to cover the cost of the consultation fee. And going to the lab, they can use the points to pay for the lab tests. Now, the DAISY Health card, or the DAISY Health Technology platform, is a secured platform, and we have today Avinash Saxena, who will speak more about the security. But I just want to quickly talk about the additional benefits of this card, this system, this platform to our physicians. For one, it is completely cloud-based. So therefore, nothing is downloaded onto your computers. You can log into the platform or onto the platform anywhere at all with any device once you have an internet connection. Therefore, it means that you will always have your patient's records with you. Now, it is secured, and I keep emphasizing on the word secured because priority number one for us at DAISY is security, patient record security. If a patient has some challenge and contacts you in the middle of the night or when you are not at your office, you can always work with that patient because you know what is in the patient's files. Also, I know there are some doctors who have offices that are very cluttered. It might be file cabinets or it might be just the files outside on a cupboard and you're now wondering, where am I going to find more space? Here it is that we are helping you to clear up that space. You might have a room that's dedicated for files alone. You can use that room now for something else. It can be a treatment room, or you might even want to rent it out to an associate doctor. Now, some physicians might say, but I already have a system working in my office. Now, this is what we know to be an EMR. Now, DAISY is not an EMR. It's different from what you have in your office. What you have in your office will only work in your office. It does not interact with the outside. DAISY is an ecosystem, and the patient is at the center of this ecosystem. And so with DAISY, you will have real-time interaction with the pharmacies, with the labs, with the emergency services. Your patients can make appointments through the system. You can make appointments for your patients, cancel these appointments, and set new appointments, and everyone will get a notification. As the time gets closer for the patient's appointment, they will also be notified. Now, think about it. Right now, you have physical records in your office. You might not be able to go through all of these records to see exactly how many hypertensive or diabetic or patients who have cardiovascular conditions or other conditions. Now with DAISY, all of this data is compiled and you will be able to do certain analytics with this information. Thereby, you can create programs in your office that you can build out to work more efficiently and effectively with your patients. For example, if you recognize that you have a population who is under 40 and the percentage of these patients are diabetic, you can come up with some program to help those patients. The DAISY Health Technology Program is a program for all physicians. It is right for every single one of you here today. I know one of your biggest concern is safety and the security of the data. Now, I want you to quickly, just think with me. A situation where you have done a blood test and you were told to pick it up or the information would be made available in 2 weeks. But after 5 weeks, that information was still not available. You speak with your doctor and your doctor says to you, I don't understand. I have not received the information. The doctor speaks to the lab and the lab says, this information has been sent over. How frustrating can that be? Now, let me tell you, our CEO, Sir Avner Sexana, he experienced this and other unfortunate events with his records and his results and all of these things. And so he sat down and he thought about it. Now, Avinash has experience in the medical field. He is a pharmacist by training. He's also a clinical psychologist, and he has worked with many pharmaceutical companies in the United States, in the Caribbean, in Asia and Southeast Asia. And so he knows about the medical industry. He knows about healthcare. And so in consultation with many doctors, many pharmacists, and the lab owners, this program was conceptualized. After months of work, building, breaking down, building up again, a pilot project that ran for many months, we now see the result of that. And we're still working on it to improve it. But I'm gonna stop talking right now because I want Mr. Avinash Saxena to speak about the security of the Daisy Health platform. And so I hand over right now to Avinash.
Thank you. Thanks a lot, Gav. I would like to take this opportunity to thank Caribbean College of Family Physicians to give us this opportunity to present something which we believe is pathbreaking. As Garth was talking, the program conceptualization actually came out of our personal experience and typically my experience where I was traveling due to some unforeseen circumstances. I was required to go through an emergency procedure. I didn't have my medical records. I requested my medical records, but as it was an emergency, we couldn't have waited for long. They said that if I would have been able to produce those records, I could have saved something at that situation and some time could have been saved. But then the hospital was forced to go through the whole process of testing, establishing everything. If I'm allergic to whatever information I could provide them, I was able to do it. But post that, I realized that it is something which we have to look into. Is there a gap which is there? What is that needs to be plugged? After talking to people across the globe, and I'm talking of across the globe, I'm talking of Southeast Asia, I'm talking of Singapore, I'm talking of Malaysia, I'm talking of United States, I'm talking of multiple countries in Europe. We were able to realize that, yes, electronic record keeping is not something which is new. It has been in practice. It is as old as 15 years, 20 years, but most of the systems operate in a silos. So like if I'm going to 2 different hospitals or 2 different medical practitioners, I have my data which is available, which I can access using dedicated logins. But what if that data has to be communicated? There has to be an interoperability of the data. We started designing the program and we take pride in saying this, that this is the first of its kind program developed in Jamaica, which is going to a global platform. We have already applied patents for this in across 79 countries, including Jamaica. So, and we don't call it as Garth was pointing out, it is not an EMR. It is actually an ecosystem. And you all very well know in an ecosystem, there are multiple factors, multiple individuals, multiple entities which help the ecosystem to operate, flourish. There's a synchrony which has to be there. So what I'll try and do in my next 30-35 minutes of presentation is try to cover the aspects of the program, and we'll try and address the biggest worry which is there in the room when we are talking of online space, digital space, security. Security is something, and now we are talking of health records, we are talking of data privacy, security. So I'll try and touch upon those things during the presentation. So let me share my screen with all of you. So with my presentation, what I'll try and cover is talk about the basic timeline, what's our vision, what's our mission, what's the market challenges we were looking at when we were designing the program, obviously security and privacy, the product offering as such, the ecosystem and the advantages which Daisy offers over anything which is available in the market. So 2019, the company was formed in Jamaica with a clear focus of creating ecosystem which can bring together everybody, keeping patient as the central pivot and connecting everyone, starting from medical practitioners to pharmacies, pathologies, radiologies, hospitals, emergency services, and to make sure that the program is making everything real time, the interaction is real time, the data is moving seamlessly and can be accessible from anywhere, irrespective of the geolocation at any given point of time, which will facilitate multiple things. So 2018 was the formation of the organization. Jamaican partnership was started in 2009. And if you look at the timeline, we started our pilot project sometime in 2020. And as of now, we are in the process of commercializing the project. And we have 10,000 plus patients who are already there on the platform as of now. So our vision was obviously to give the control for health and data in patients' hand, where it can be just on a click of a button, they'll be able to access things, they'll be able to see things. It gives everybody in the ecosystem that liberty to move around with the data and not being stuck to a place for accessing. And as they say, data is as good as if it is available on time. If it is not available on time, it serves no purpose. So we have created a system which is highly secure, safe, and the data, as we said, can be accessed from any geographical location. What were the problems we were looking at addressing was obviously one was data warehousing. Looking at majority of the geographies, especially when we talk of developing countries, and in Jamaica, we were looking at paper-based data storage. We were looking at, in an unforeseen event, loss of files, loss of dockets. Somewhere, few of the people who were involved into the project explained to us that there were times when there was break-ins, there was fire in a place, the dockets were lost. Recovery becomes at that time pretty difficult. Misuse of the data, misuse of the prescriptions was something which was brought to us, that people, when you give a prescription to a patient and in system, we as human beings are pretty smart. We try and figure out a way, how can we misuse something? And if there is something which has been prescribed and if can be over dispensed in some or the other form, how can I figure out a way? And there are no red flags with such a paper system. And obviously government is something which, when they are looking at, they are trying to budget it out. The data is not coming to them. Accessibility, portability, what is happening, the control of the data, and the data transfer between the users. Those were a few of the things which we saw as the market challenges. And that's where the concept of DAISY came in, where it's as Garth explained, it's an online system based out of cloud as of now. So the data can be accessed from anywhere. The ecosystem consists of anybody and everybody in the healthcare system who's servicing the patients. The beauty of the system is that it would provide tertiary level health analytics, whether it is at the level of a practice or it is at the level of country. It will obviously help manage the clinic activities better. As I was listening to Madam President, she said that obviously, eventually medical practitioners, you also are business people and you are looking at operating the business efficiently. So what we thought of was like, why can't we create a business suite which can help you manage all of the system properly? If it can give you analysis, if it can give you analysis of a period of say 2 years on your dashboard, where you can see how many old patients, how many new patients have been coming in, what has been the financials which have been involved when it comes to the practice, what type of patients have you been catering to, if there are any specific type of patient category which has been coming to you more, so which would eventually enhance the output. But the major concern, the moment you start talking about an online space, is cybersecurity. Everybody has this in their head that who has the access of the data, who has access to my data, where is the data hosted, is the data actually secured, can somebody access it in an unauthorized way, what will happen if the data is lost. It is one of the conversations which happen in the digital or online space most of the times, and we have been hearing it even in the past, that systems like Microsoft, systems like Google, systems like Facebook, they have been hacked. The data actually came onto in the public space where your personal data is getting exposed. What happens in such, and what will happen if it falls in the wrong hands? So these were the questions we were, when we started designing the system, we were parallelly working on. We were talking to the experts, how this space can be secured. And it was all the way more important for us to even understand the law of the land, the law which governs data privacy around the world. Are there any regulations? What are the highest standards of regulations we can follow? So that's where we sat down with our team and we decided that we have to go with the highest level of security, which can be plugged into the system to make people secure while they're using the system. That's where OWASP Top 10 certification came into place. This is a certification which is given to organizations who qualify for any type of threat at any given point of time when you're using an online system. Encryption was something which we were looking at, but again, what level of encryption? And once I go forward and I start explaining the points, I'll tell you what level of encryptions are we using and why did we choose that. Can we create a database which is decentralized, which is fragmented, so that even if in an eventuality where somebody is able to get into the data, it is so much fragmented and decentralized that nobody is able to make sense of what it is coming out. It is not, you're not able to associate it. HIPAA is a well-established guideline which is being followed when it comes to health data, data portability. And we went one step ahead and we wanted to follow the highest level of standard, which could be in the space of data security and data privacy. And that guideline was given to us by GDPR. GDPR is the General Data Protection Regulation. It is the law which is being followed by Europe, and they are the most stringent when it comes to personal data, and especially when it comes to health data and health information. So OWSAP in overall, it just helps you prevent certain things which are responsible for unauthorized access to a system, where data storage, the data movement, insecure communication which is happening, authentications. Can there be brokerages? Is there a bad code or code tampering which is happening? What type of alerts can a system issue? What will the action the system take in case of an eventuality where somebody is trying to get in? And we see that all the time when these days, in the past 2 years, we have seen ransom hardwares, ransom softwares which just came in, they freeze your system, they don't allow your system to be accessed. And there is either you have to, if you have a backup, obviously you can get on with it. But even with multiple governments, they have at times, they were forced to pay these guys before they were able to track them down. So this was something for which we have been certified that these things actually cannot happen. With our system, if somebody tries and access this system and they're trying to plug in the passwords, after 5 attempts, the system will lock you for 15 minutes. Again, after 15 minutes, the system automatically unlocks. But if the attempt happens again, it is incremental. It will continuously keep on increasing it to a level where it becomes difficult. It is because of the technology what we have plugged in, where data packets cannot be bombarded onto the system for hacking your password. Next was encryption, and everybody these days is talking of encryption. We talk about encryption. WhatsApp has been talking about encryption, encrypted programs which are there, and the highest level of encryptions which are being used on the public platforms is 512-bit encryption. Beyond that, everybody knows once you start going heavy on the encryption, the system tends to become slow. And for us, we were talking of making things real time, making it convenient, making it user friendly. And nobody wants to be sitting in front of the screen where the timer is going on and then there is a dongle which is just moving in between and nothing is happening. So after talking to our experts, security experts, we decided that we'll go with an RSA encryption, and we went to a level of 2048-bit encryption. That is the second highest level of encryption which can be achieved without making the system slow. But as the RSA technology, and most of us know because our banks would have given us RSA token, it is based on a public and a private key. So private key is generated by your login, whereas the public key is generated by the system on which you are operating. Once till the time those two keys don't come together, the data cannot be decrypted. So we went to the level of 2048-bit encryption to make sure that the system is secure. Then there were questions like what actually happens when we're using the system. So there are multiple terms which are used, which is data at rest. The data at rest is one of the major concerns around the world. When you're using a system and everything is stored on your system, that's where all the spywares, ransomwares, malign softwares through a Trojan horse come and sit into your system, and they keep on continuously transmitting your data at the background, which you are not even aware of. So this is one of the biggest vulnerabilities which could be solved by going to a cloud-based program, because there is nothing which is at rest except for what you're working on. Rest, everything is stored away from the system. Then the next question is data in transit. What will happen? And you would like to ask that question to me also, because if I'm a cloud-based program, why is that, Avinash? This is not a concern. But through the certification, the security certifications and encryption, we were able to create that secure channel where penetration becomes difficult. But most of all, what was important for us to understand was that how it should look like. What should the program be like? Everybody will have a question, Avinash, why should we give you access for something which is too personal to an individual? So we created the program on HIPAA guidelines, where the visibility of data is absolutely defined on parameters where whosoever is authorized to see, like obviously you as medical practitioners, you are required to see everything as a health record, the complete data in totality. Whereas say if I'm talking of a pharmacy is required to see a prescription and nothing beyond that in terms of what they're supposed to dispense. There could be plus and minuses based on regulations or the law of the land for that specific discipline. Same goes for radiology, same goes for pathology. In case of emergency services, what can happen? What they are supposed to see is they're supposed to see if you are on any chronic medication, are there any underlying diseases, what's your blood group, what you're allergic to, so that they can be effective while addressing that patient in that golden period, which can actually contribute to the chances of saving someone in a case where they are not able to communicate with you, and or if there is some nobody there with you. So that those were things which were one of the guidelines which we had used from HIPAA. But our framework is based on GDPR. GDPR clearly states that the personal identifying information, which is PII, and personal health information cannot be kept together. It has, the programs have to be designed in a way where there are non-relational databases, where say if somebody gets a hand on my data, they would be able to see there is somebody called as Avinash Saxena on the system, and they might see some other health data, but there is no way for them to associate Avinash Saxena to a health record. So we made sure that we created the system in a way where both these informations are kept apart. And on top of it, we as data managers at the back end are also not able to see anything. So that's one of the requirements for you to be certified for HIPAA and for us to be going for GDPR certification. The system has to be designed in a way where we are not able to see those things together. We should not be able to associate an individual to a record. But obviously, we being data managers, we should be able to see that data is getting generated, because tomorrow if something happens, somebody comes back to us, and I also saw a question when it came to in the Q&A just now, and although it's not the right time, but it's relevant for me to address it right now, that if somebody loses the card, what happens? How will that information, how can that information be provided to address that specific situation? A patient is going to get his medicines are over, and he lost the card. So now nobody will be able to access it. So we should be able to create a tool where without even the card, but with certain security parameters, the pharmacy would be able to access that record and will be able to service the patient for that need. So that is something which we took care of while we were designing our program. So we created a comprehensive system which is maintaining everything while catering to the patient and taking care of the need of every individual who is involved in that patient care. And that's where we have designed all the suites, business suites for each service provider, where it is specific to them. It will handle a specific issue or a situation for them. It would help them increase the efficiency. It obviously, it will give them analytics. And in today's scenario, when we're talking of data, analytics is something which helps you increase the business, take it to the next level. We would be able to take right calls at the right time when the data is in front of us, rather than going through pieces of paper. If some sort of graphs can pop up in front of us, which is giving us indication, and then we can get into details, deep dive into it if the need be. So that is something. Then it gives you audit trail, because we are talking of business suite. And when we are talking of business suite, in every entity, there'll be multiple users. Say in a doctor's clinic, there'll be the medical practitioner himself, but then he'll have his nurses, he'll have his receptionists, there'll be assistant doctors, there might be associate doctors. And you want to be sure that who is doing what can be done. You'll be able to see actually an audit trail, that what is that this person has done over that period when they were accessing this specific record. It actually logs the IP address of from where it is, so that even you will be able to identify it. And it also helps us to identify if it is coming from an unknown IP address, which was not usual to this specific practice, which will raise an alarm, which will raise a red flag for us to take an action. And at the same time, you'll be able to see, so that in a situation, a disgruntled employee want to do something, it does not allow them to do anything. They'll not be able to download data. The system does not allows. It does not allows people to delete the data. The data is immutable, because that is one of the requirements when it comes to GDPR and HIPAA. So this was something which we are proud of, which we created. And as an ecosystem, as I had mentioned, that medical practitioners, patients, pharmacy, pathology, radiologies, emergency services, hospitals, it can be expanded to any level. And as Garth mentioned, we are in the process of, this is something which will keep on evolving continuously. We have been able to get to a space, and I would take this opportunity with respecting the confidentiality to the people who have contributed in developing the system. And it involves medical practitioners, pharmacists, pathologists, radiologists, people in emergency services, people in hospital, to help us design this program and make it a real-time ecosystem where the data is flowing flawlessly. So patient's advantage is obviously the medical history is on their fingertips. It can be, they can see their prescriptions on the app. They can see once the reports are ready from a pathology, they'll get a notification, and the same notification will go to the doctor. There is no back and forth which is going to happen between you or the lab and the patient and the lab. At times you're trying to chase whether the reports are ready. You're not sure when it is going to be ready. Your pharmacist will be able to talk to you on the doctors. That's one of the features. Calendar management. Everybody talks of appointment management systems, but what we were able to achieve was, in true sense, a contactless patient appointment management system, where the patient will be able to go in their app. They will be able to choose you or their family physician and practitioner, look at their calendar. And this is working on closed loop system so that nobody else has an access to it. They'll be able to book an appointment. It would be they will be able to monitor their health better. You, in your continuous endeavor as medical practitioners, continuously keep on talking to your patients, guiding them through the whole process. But eventually, I as a patient, it is my responsibility also that I'm able to see things and I actually adhere to what's being told to me. So this is something which the patient program offers as an advantage. When it comes to clinic, we will be able to digitize your clinic completely. We will be able to convert all your existing records, which are in a paper form. We will be able to make it, we'll be able to digitize it, and they will absolutely be accessible only and only by you in an encrypted form. You will be able to manage your appointment system where you will open up your calendars or you'll be able to close it in a case where you have an emergency, you're walking out, and now at times it becomes a tedious job for the staff to call all the appointments, existing appointments, and tell them that, oh, doctor won't be available, and what is going to happen now. While you cancel the appointments, patients are going to get a notification that because of this, because of an emergency or a situation, the appointments for the day has been cancelled and they should reschedule the appointment. You'll be able to do a staff management. You'll be able to see their activities. If somebody joins in new, they can be created as a user. If somebody leaves the job, you'll be able to deactivate them so that they'll not be able to manage it. And on top of it, there'll be a leisure management, which is absolutely personalized and specific to you, and nobody else has an access to. Even we as data managers don't have an access to it at the back end. It is something which is unique to your login, and you will be able to see it and manage it and monitor everything. For other service providers, when I use the term OSP, I'm talking of prescription, I'm talking of referral request, I'm talking of stuff like reports being communicated. What is happening there, the type of information which is flowing in, dashboard for the systems. At the same time, the system offers communication between two medical practitioners. Family physician has, say, in a scenario, asks me to go to my go to a cardiologist for consultation for a specific condition. Now the referral can be made through the system, and you will be able to release the data to the referred physician through the system, and they will be able to see whatever you have released. Otherwise, the data is not accessible to anybody else till the time you give permissions for the data to be released. So that's our philosophy, was bringing up a solution to the table where everybody is connected in real sense. Communication is happening in real time in a secure environment over a secure platform, which can give them confidence, which can stop the misuse. And we have been in talks over a period of time with multiple agencies and authorities where we have even seen the comments like where people are trying to use tests, COVID test reports, trying to fudge those reports, change dates, not getting tests done, traveling. There's no way for even authorities to check it, whether it is coming from an authentic source, whether actually the test was done on that day or not. So this is something which, again, as a modality we have created, and we are right now working on just fine-tuning it and then bringing it to the market along with the existing features what we have available. And definitely we are looking at partnership from all of you, which can help us improve the program further. Because for us, being a Jamaican program, we would need that guidance, we'll need that appreciation, we'll need that helping hand even from your side as inputs, which will help us continuously improve the program and take it to the next level, which there are multiple things which we are evaluating right now, but based on the adoption, based on acceptance, and based on the need, the system will continuously keep on evolving. So that's pretty much us. As we can be reached, or you can look for us at via our website, which is daisy-health.com. People can reach us on our toll-free line. You can follow us with our updates on Twitter and Instagram. So that's pretty much from my side. Thank you. Thanks a lot.
Thank you so much, Avinash. It's a comprehensive presentation. And I see from the Q&A that it has generated quite a few questions.
Yes, sir.
I also want to thank you for bringing us back on time with our timeline. You did it rather well. So at this time, I'm going to open, Samuel, you will need to assist me with this. How do we go through with the Q&As? Does Avinash and Mr. Russell take the questions in the Q&As, and do we open the floor for other questions to be posted in the Q&A?
All right, so sure. Thanks, Dr. Levy. So we're gonna ask persons who would like to ask live questions to raise their hands, but first we have 10 questions in the Q&A we're gonna try and go through. The first is from Dr. Brooks McKenzie. What happens if the patient loses the card with the information to fill the prescription at the pharmacy? That's the first question.
So while during my presentation, and that was the first question actually I saw on the Q&A list, and I just wanted to make an example. So the program is equipped in a way where not just patient losing a card, there could be a chance where patient forgot to carry the card with them and they have gone to the pharmacy. How can the prescription be accessed now? So they can call the toll-free number. There are certain set of security questions which would be asked by the our customer service. And then what will happen is a specific code would be sent to the pharmacy, to the patient on their phone via text message. They will be able to give that code to the pharmacy, and the moment they give that code, the prescription will get unlocked and they'll be able to see what is there to be dispensed.
Okay, perfect. Next question is from Dr. Anna Brown Morgan. It's during the last tropical storm, there was a power outage. Some persons lost power for over 24 hours. How would I deal with that situation? Do you supply me with a small power source?
So I'll try and address it in a different way, where yes, we have been looking at options of taking care of your stuff when it comes to outage in terms of internet. We never thought of, and this is something which as a question came to us, I'm absolutely sure that there are UPSs and backups which are there during the period of your practice, but we are looking at a modality where we will be able to give you an option. Without internet, you'll still be able to use the system. But yes, when it comes to power outages, I don't think as of now we are looking at addressing that piece.
Okay, fair enough. Paul Henry says, tell us a little bit about how physicians can enter data into DAISY. Dr. Paul Henry.
So what we did was, it was something which we created as a system. It is something like a regular flow in the system where vitals are entered. You are able to capture the presenting condition. You are able to capture the history. There are different tabs in the system which will populate. There's something which is, I'm absolutely sure these days you all are using, because that's a requirement from the insurance industry, which is CPT codes to be tagged. On top of it, what we did was we have provided something which is ICD, so that the patient classification can be created using both the codes. It's something which is most of the places, it's just nothing but click and selection from drop-down menus. The moment you'll start typing in, say, in the medication section, it will automatically start giving you the options of the drugs and the brands which are available in the market, because we have uploaded a master database for everything, whether it is medicine, whether it is the pathology and radiology tests. So that is something which is already there at the back end. Garth, you want to add something?
Yes, just wanted to say that we do provide a demonstration. So you can go to the website that Avinash posted just now, daisy-health.com, and you can request a demo, and a business development executive will contact you. Demos are available face-to-face and also virtually.
Excellent, excellent. So Dr. Francine Robinson Simpson has a number of questions. I hope it's Dr. Simpson. First one is, will this technology be based only around private practice, or will it be offered in the public sector, whether primary or secondary care? I hear reference being made to Jamaica often. So how soon is this expected to be rolled out in Jamaica? And will there be a training sessions offered? Got you first, sir. Will there be training sessions offered to staff who may have to use this platform? So I think Gard kind of answered that already, right?
Yeah, so and when it comes to the private and public sector, yes, we are looking at actually creating that bridge between the private and public sector. So we have been talking, we have done our presentations, but we will be able to call it an ecosystem if we are able to bring everybody together, which would include the public sector also. So we are looking at it. In the private sector, the program is already available. With government sector or public sector, we are in talks, and we know we are pretty swift out there when it comes to decision making. I'm sorry to say that, but yes, it is making progress, and the progress is a bit slow, but we are looking at something happening, and we will be bringing out as a news in the market in what form we will be connecting the public sector through public and private sector through this program.
Fair enough. Will persons have to go to specific pharmacies to access this feature? They noticed in the video that the pharmacy had the DAISY technology stick on the door.
Yes and no. So yes, obviously people have to be a part of the program to be accessing it on flawlessly and without any hampering of the surface. But if a patient walks into a pharmacy with the card, and that's the choice of pharmacy the patient has, and patient is not carrying a physical prescription, so the pharmacy will be able to call us. We will be able to create a temporary account for them to give them an access, which obviously will help us also to reach out to the pharmacy and bring them out to the program. But we have made sure that in no case it happens that patient is not serviced. So yes, they will be able to access.
Okay, perfect. So then the next question is, and it's midwife Francine Robinson Simpson. How would your information be accessible to other physicians you may need to visit outside of your country if the system is secured? What means would be used to provide such access?
So if I'm understanding the question right, when it comes to other physicians, what will happen is that once my card is swiped onto the platform, right, you will be able to see two types of records. One is obviously the records which have been created on your system, and the other, for which we term them as external visits. You will be able to see them. They'll be in a locked form. The physician who's looking at those logged records will be able to request the physician who created them to allow them the access, and the access can be granted. And outside the country, when it comes to physicians, if we are talking of physicians, you'll be able to access it through the login which we have provided, which has a dual factor authentication, and it's absolutely secure to be accessed from anywhere because it works on a closed loop system.
Okay, hopefully that answers it. So as the primary care physician who refers a patient to a specialist or consultant, will I have direct access to the direct findings, procedures, and treatment done by the specialist, or do I have to wait for a report? This is from Dr. Slowly.
Yeah, so answering this, no. So you will have an access you will be able to see, but making sure while talking to the physicians that they want to have that confidentiality, maintained, but on the request, the data can be released. So the process remains the same. The only thing is what we have done is you will be able to get responses faster, because the moment you'll send a request for the report to be released, for the treatment report as such to be released, the physician on the other end, the specialist, will be able to release it. Whereas when it comes to all the procedures and tests, they will be uploaded and they'll be available for you to view.
Okay, perfect. The next question, as the primary, okay, sorry, from Dr. Brooks McKenzie again, how much of the patient record can be accessed by the patient? And is this done via a patient portal?
Yeah, so patient would be able to see all their visits, their prescriptions, their reports via use of a patient app, which is there, and it can be accessed through web, through a specific URL. They will be able to see the pieces which we have tagged it in consultation with the doctors that patient should have access to, and they should be able to see. Otherwise, other things will remain confidential and patient will not be able to see. So, there are notes, there are remarks which have been made there where it is for you to be kept with you for the future visits. So those things won't be visible to anyone, not just the patient, but anyone.
Okay, fantastic. How would this system, this is from Tenant James, how would this system assist in monitoring patients who drop out of treatment? Patients with psychiatric illnesses tend to drop out of care and would like a system that would alert us before they relapse.
So it is actually a two-pronged question. One is obviously the basic practice of what happens with the patient or an individual, and people tend to, what we did was to address at least one piece of it, was when the patient is going to the pharmacy and is fulfilling the prescription, actually you'll be able to see whether the prescription has been fulfilled, whether it is partially fulfilled, what quantity of it has been taken, and which will give you an alert if somebody is not taking the medication at all and comes back to you. The moment you'll swipe the card, you will see all these statuses, whether it comes to test, whether it comes to medication, what is the status of the prescription. We have been evaluating, and that is something which is a work in progress, but eventually it will depend on the patient to enter that data into the app, which we are still evaluating to develop, where it will give them an alert that this is time for them to take medication, what has to happen. But we have addressed one piece of it, that yes, you will be informed through the profile what is happening actually to the prescription, which as of now does not happen. You have given the prescription and we are not sure whether they have taken the medication. The medication say the patient has been given something for a 90-day period. For what period did they even bought the medicine for? So it will address a certain piece of it, but not to a level where we will be able to alert you in terms of that they have dropped out completely.
Okay, fair enough. Again, guys, if you'd like to ask live questions, you can do so as well. Just raise your hands using the raise hand function. From Ovi Cooper, do we need a swipe machine to read this card? Can this card be viewed in the public system just in case of an emergency? How does one get this card, and how much will this card cost me?
Okay, thanks a lot for this question. And this is something which we were cognizant about. We didn't want to bring in something where you have to buy hardware, you have to change your hardware. Your existing card readers, simple card readers, would be able to read this card when it is swiped on the defined URL what we have. And in case of a public system, no, it is not available for an access when it comes to any place, but it has to be swiped specifically on the URL or the login what we have created. But they will be able to access it using, if they have an emergency login with them, they'll be able to see it. We will be providing you with the pre-programmed cards, and the cost of the cards, it's absolutely free. There's no cost associated to the card. There is a cost associated to the card, but that eventually goes to the patient. The card has a life cycle of 3 years. It has an expiry, and after 3 years, we reissue the cards to the patient. But if during that period, and we have seen during our pilot, that something which is free is not being taken care of properly. We have seen people coming back to us in 10 days time, 15 days time. Oh, I misplaced my card. Oh, my card was broken. And that's where we were forced to input a provision where if during that 3-year period, somebody requests us for a replacement of card, we would be charging $500 to the patient directly. And we will be replacing the card. But for the doctors and medical practitioners, it is going to be free of cost.
Okay, perfect. And that's, to be clear, that's 500 Jamaican dollars.
500 Jamaican dollars, absolutely. I'm talking absolutely everything in Jamaican dollars here.
All right, no problem. I think we have a hand raised here. It's from Janine Nelson Imoru. Janine, if you can hear us, you should be able to unmute and ask your question directly to the team at Daisy. Janine? Hi, Janine. All right. Perhaps Janine is a bit shy. So we continue with some questions here. Monica's nanny congratulates you on the system. She wants to know, when the patient sees their information, can they edit it at all?
No, absolutely not. Thank you, Dr. Asnani. But this is something which is a read-only information for them. The system cannot be edited. They cannot do anything with the information what they're seeing there.
Okay. A bit of legal, which we'll be going into later on today. Can a government agency demand access to the records? I suppose it depends on the jurisdiction, eh?
It depends on the jurisdiction, but eventually this is something which we have been having a conversation with multiple agencies. Eventually, the data owner is the patient. We are not the data owners.
Right.
So the permission has to come from the patient. I am nobody to hand over somebody's data to somebody, just like that. Yes, a certain jurisdiction where there are laws and provisions in the law which will compel us in a way, but data can be produced. But if it has to be produced, it has to be anonymized. If they're looking at specific data, we are not at liberty to share that. The permission has to come from the patient.
Okay, great. The data in the EHR systems in the US is structured data. I'm not sure if that was a question or a statement. Is Daisy in Trinidad and Tobago? If not, is there a plan to enter our jurisdiction? So that's from Dr. Henry, who is in Trinidad.
Absolutely, Dr. Henry. We are right now in the process of preparing a presentation, and we are looking at entering Trinidad. And in fact, we are in talks with multiple geographies in Caribbean to introduce the program.
All right, sounds great. Anne-Marie Stewart, when the patient takes the card to the pharmacy, how confidential will their health history be?
So as I said, because of the regulation and guidelines, the framework, it is going to be accessible to the pharmacy. When pharmacy swipes the card, a pharmacist is going to see nothing but some basic bioinformation of the patient, doctor's details, because obviously they have to know it as per the law. The Pharmacy Act states that they should be able to see the details from where the prescription is coming, which physician has prescribed it, and the medications to be dispensed. If they have any further doubts, they will not be able to see anything beyond that. If they have any specific questions, they will be able to actually chat with the doctor directly through the system to ask the questions, and it would be documented if any such sort of conversation happens. So it's absolutely confidential, and the data will remain in the system. So we don't have to worry about it.
Okay, perfect. And I'm just following up on the information before. As you see, this is the website, daisyhealth.com, and it's beautiful, wonderful site. And if you go, it does have sections about data security, etc. And there's a request demo. So doctors, pharmacists, I'm sure they can come online and put in the information here to get your demos so that you can see physically how that works, right? All right, so the next question we have, when the patient takes, okay, we did that one. If an individual uses the card often, will they gain any points? That's interesting. If yes, can these points be used to access doctors, consultants, or assist in medication purchase? Aha.
So yeah, so this is something Garth touched upon. So what happened is we did a technology partnership with a company called as PPL, that's Puja Points Limited. They came up with a program which is specifically focused on healthcare, where patient will be earning points on the medication they are buying, and then they will be able to use it to buy those points can be used to buy medication, to actually pay consultation fees. And we are looking at, they have been working on it tirelessly, where they're looking at the use of the points in any and every arena. When we are talking of groceries, we are talking of restaurants, we are talking of them being able to pay the bill for a gas at a gas station. So this is something which they're working on, because their basic philosophy was that this is something which is a huge expense what they do. And if they are able to earn something back as points and which can be utilized within the system to assist, this is where it came into play. Yes, they will be able to.
Awesome. And so final question, because we're running out of time, not because we're running out of questions, is from Prudence Buchanan. What about a virtual practice? You know, she understands that, you know, you can visit these places, but what if you've done a virtual visit with a doctor? Can we still use this system?
Yes, the system can absolutely be used. So we have not integrated as of now the system when it comes to telemedicine, but that's obviously a future plan. But the data can be captured. There are ways and means in this system which when the team is going to come to you and they're going to demo, they will be able to show it to you, that you'll be able to record that data.
All right, perfect. Thank you guys so much. Seeing some wonderful questions here. I see one about speech to text here. If you help doctors to just speak to the system and then it converts it to text and they get certain things. So what I'm gonna ask you guys to do is just click on the Q&A button at the bottom of your pages. And you can just click on the type answer. Once you click on type answer, you can just reply and answer there. Thank you guys so much. Dr. Levy, back to you.
Thank you, thanks a lot.
Thank you, Sam. You handled that Q&A session rather well. Thanks. Many questions generated. So far, we have 626 participants and growing. This is a wonderful session this evening. So let me congratulate Daisy Pharma Online for their presentations. Of course, there'll be, at the end of our program, the vote of thanks done in a more formal manner. We now move on to the telemedicine session. And the telemedicine session, our presenter for the telemedicine session is Dr. Keno Francis. Dr. Keno Francis. Let me tell you a little bit about Dr. Keno Francis. He's a co-founder and chief medical and technical director at Prime Medical and eDoc in healthcare platform. I hope I got that pronunciation correct. This healthcare platform is a healthcare platform dedicated to connecting doctors and patients and delivers more efficient, affordable, and accessible healthcare. He is happily married and is blessed with two lovely daughters and a mighty prince. Keno is a graduate of the University of the West Indies, Mona, where he completed 3 first degrees, spanning chemistry and biochemistry, a double major, basic medical sciences, and medicine and surgery with honors. He has since then completed a postgraduate degree in diagnostic and interventional radiology with the Royal College of Radiologists, London, and is now a fellow of the Royal College of Radiologists, London, England. He's a radiologist at Prime Medical Jamaica an innovative healthcare system for which he's co-founder, is here to put a dent in the universe. Dr. Francis can be described as a problem solver. He has a keen eye for the use of technology to solve everyday problems. He's also the co-founder and technical director of Violakis Innovations, a local software development company dedicated to the delivery of cutting-edge and cost-effective software technology, given any situation. His most recent contribution to medicine is his radiological sign, which was recently published in the British Journal of Radiology, the Omega sign. It is a CT scan sign which has the potential to improve the pre-operative diagnosis of an abdominal complication. He is guided by the quote, "We are here to put a dent in the universe. Otherwise, why else be here?" A quote from Steve Jobs. I now invite Dr. Kino Francis to unmute, share his screen, and present on telemedicine. Thank you, Dr. Kino Francis.
Yes, thank you very much for that laboring introduction. Let me just share my screen. Is everyone seeing my screen?
No, we're not. Is this a Mac or a Windows PC?
It's a Mac.
Okay. When you click on share screen, what comes up?
The shared
Broadcast.
shared
Shared.
button.
Click on the shared button again. Yeah.
Yep.
You have to double click on it.
Says open system preferences.
Oh no, it sounds like, have you shared with this before? Because sometimes what happens is if you haven't shared with this device before, you have to actually open the preferences, put in your password, and give Zoom the permission to share your screen.
All right,
So you might have to do that.
let me get on that now.
No problem. So in the meantime, everyone, I see everyone posting their email addresses and requesting. The CMEs will be given to everyone at the end of this session once it is approved, and all you have to do to qualify is attend and participate in the way that you're participating already. So Dr. Miller, Dr. Thompson, persons there is no need to share your email address. You're here. We thank you for being here. Being here is all you have to do. Your email will be registered in case you're using a phone or someone else's device and your actual email is not what you've logged in with. At the end of the session, there's going to be a little Google form that launches and it's going to ask you for your email address. So just put your email address in there and we'll, at the end of everything, ensure that you get it. And just in time for Dr. Francis. Dr. Francis, over to you.
Yes. All right. So just confirming, are you seeing my screen?
Yes, sir. Telemedicine in the new world.
Okay,
And
wonderful. All right, so I'd like to thank the organizers for inviting me to speak on this topic, telemedicine in the new world. I am Kino Francis. These are my disclosures. I am a director and chief technical officer at eDocs Healthcare Platform. I'm also a director at Violakis, as said before, and a radiologist and director at Prime Medical. So we're gonna look into a couple of aspects of telemedicine as it relates to Jamaica. And I'm gonna outline the current problems, highlight a few case studies, take a brief look into the eDocs mobile app, and look into the future to see what it has for us in terms of telemedicine. Now, what is telemedicine? It's a very broad term, and it is basically the use of technology to deliver healthcare, whether it be the use of email services, video, audio call, text, instant messaging, notification services. It was first introduced in the 1950s by NASA, yes, NASA, where they had the need to monitor the health of their astronauts out in space. Now, the current problem in our health system is experienced by both developing and developed countries. In the United States, as well as Jamaica, there are limitations in human resources, healthcare infrastructures. In the US, we can see that there is less than 3 medical doctors per 1,000 patients, and they have only a few healthcare centers, 1,400, about 5,000 hospitals. We may say this is quite a bit compared to our situation, but they have a population of 350 million. In Jamaica, the situation is far worse. We have less than 1 medical doctor per 1,000 patients, about 2,700 medical doctors roughly, and about 700 specialists across the island. We have roughly 24 public hospitals, 10 private hospitals, and a few pharmacies. Now, what does the experience entails for a patient trying to access a doctor's service? First, the patient has to find a doctor's office. They have to take time off from work. They have to incur transportation costs. And in some places, some doctor's office, you have to wait between 1 to 3 hours before seeing the doctor. And if the doctor sends you to go to fill a prescription or visit an X-ray place or do a blood investigation, you may have to wait another 1 to 3 hours at these locations. Now let's look at a case study that was done by the University of California, Davis, where they compared the use of telemedicine versus in-office visits at our traditional brick and mortar setup. It was a retrospective study done over a period of 17 years where they analyzed 20,000 video consults among roughly 11,000 patients. What did this study find? They found that there were significant savings in terms of travel distance savings from a value of about 5 million miles of saving. You could travel from Kingston to Montego Bay 60,000 times with the amount of savings. There was a travel time saving of roughly 4.7 million minutes. That's roughly 9 years. Travel cost savings of about $3 million US. We could buy 2.5 million beef patties with this $3 million. Significant savings, lots of money. There was round trip there. The mean per consultation round trip saving was roughly 280 miles thereabout. Travel time savings of 245 minutes and average cost savings of about $156. And again, with telemedicine, the use of telemedicine, there are savings in terms of emissions, carbon monoxide, carbon dioxide, and the nitrous gases, volatile compounds. There is a decrease in terms of emission with the use of telemedicine. Another study done by the American Medical Association, they found that 70% of doctors' visits can be handled remotely. Again, just to revisit, as we all know, a doctor's visit would entail history taking, inspection, physical examination. If the diagnosis requires blood testing or X-ray examination, this would be done, as well as prescription writing and filling. All except one of these aspects of seeing a patient or a doctor seeing a patient seeing a doctor can be done using telemedicine, and that's the obvious one. Physical examination is not possible on a telemedicine platform, but all the other tools that are a part of making a diagnosis can be done or can be executed or started on telemedicine platforms. Now back to Jamaica. Do we have the infrastructure here to support a good telemedicine system? Yes, we do. We have a mobile device penetration of about 82%. Data in 2016 showed that 1.2 million persons have access to the internet. And 5 years later, I'm quite sure the number is close to doubling in terms of the number of persons. We can see increased Wi-Fi access in public transport, public spaces, workplaces, schools, etc. There's the introduction of different advanced payment gateways. Most debit cards now can be used online. We see patients that or persons that were not banked before are now banked, encouraged by the different banking institutions. And with the new COVID, well, not new anymore, the COVID-19 infection, there's a cultural change of patients. Patients are used to the traditional in-office visit are now looking for alternatives or addition to accessing healthcare whilst not having to go to see the doctor every single time in order to just reduce their exposure to the COVID-19 infection. And this was evident in the media. All these articles were long before the COVID-19 pandemic. Sagicor, Digicel, and the other stakeholders introducing prepaid cards, converting the unbanked to banked technology to improve healthcare delivery, initiated in Parliament. The Pharmacy Council of Jamaica looking into how to implement electronic prescribing facilities. Then came COVID-19 pandemic, which added more strain on the health system, limited working hours, limited clinic hours, hospitals, tapering down their operation to only seeing emergencies, limited pharmacy and lab hours. And even right now, we are just coming out of 4 days of lockdown that would have had significant impact on the access to healthcare. Whilst medical facilities are allowed to be open, there's still limitation in transportation and other services that patients would need to be able to access healthcare in our brick and mortar setup. Again, the response to COVID-19, social distancing, quarantine, isolation. Some people have been asked to be in isolation up to 25 days. What would this person do if they need to access a healthcare physician? What if they needed to refill their prescription because of their diabetes or hypertension? COVID-19 has caused significant limitations in the function of the health service. Yes. Is telemedicine the solution? Some will say yes, some will say no. Let's take a quick look at eDoxin. It's a healthcare platform that basically creates a community that connects doctors and patients. It was developed by UA graduates from Mona and Barbados. And it's geared towards creating easy access to doctors being able to easily connect to their patients. It's available on mobile and desktop devices on your usual platforms. It requires easy login using email, Twitter, Facebook to log into the interface. Patients can easily find a GP or a specialist because the doctors are organized in that fashion. And with this platform, you can instant message a doctor, instant message a patient, video call a doctor, audio call a doctor, book a doctor's visitor if you have the need to go in to see the doctor. This mobile platform is accessed for free. There's no charge to the doctor or the patient to install or use this platform. I spoke about the easy access and login services. And again, the other facets to seeing and treating patients. You can write prescriptions and send to different pharmacies. The patient can use this platform to send their prescription ahead of time that they have in their possession. You can send a patient to different blood taking facilities to get tested. We are also connected to different radiological houses. And outside of all of what I've mentioned, there's a platform within this app that allows patients to ask a doctor a question for free. A patient may be at home and have a burning question. There is the channel that a patient can use to ask a doctor a question for free. And if a doctor chooses, he can reply, and his profile is posted to this general feed where useful discussions and assistance can be had. Yes, there are concerns, as with all things with telemedicine. Is telemedicine safe? Is the data stored accessible to everybody? Is there restriction? And most telemedicine platforms are guided by the HIPAA compliance Health Insurance Portability Act that was developed in the US, which basically creates a framework for stakeholders that are interested in telemedicine to design their software and guide their operation. And with any system that is going to deliver healthcare, it has to be reliable and dependable. Most telemedicine systems are backed by cloud systems which have numerous redundancy. So it's very likely that you'll have a service that is ready and dependable. And there must be checks and balances to prevent both patients and healthcare professionals from abuse of this technology. Now we're just gonna take a look at what is happening in other countries. You can see in Asia taking advantage of telemedicine just in the period of the COVID-19 pandemic. China, Indonesia, Japan, these countries looking into partnership with different telemedicine companies. In the UK, a similar experience, Boots UK, creating a platform to connect patients and pharmacists using telemedicine. Again, in the UK, another partnership to support care delivery in the country areas in the UK. Mobile apps, again, here in Europe, delivering telemedicine, and the list goes on. These countries are taking advantage of telemedicine in this period of the COVID-19 pandemic. And it's time for Jamaica to take advantage of telemedicine and assist the system right now with the different, given the different limitations and the hospitals being overrun with patients that are ailing from the COVID-19 pandemic, infection, sorry. What does the future have in store for us? Well, I see interactions starting from home. The patient is being clerked from home by artificial intelligence, so that at the point when the doctor interacts with the patient, all this information would have been collected, a history is collected, and a provisional diagnosis is already made and even possible treatment is suggested. And then at this point, when the doctor is seeing the patient, the doctor would have more time to hone in on the patient's history and examine the patient in the brick-and-mortar setup. I see also urinalysis, blood taking starting from home. A patient is able to do self-administered tests to send information from a remote setting to the doctor. And currently we are already having blood pressure machines, glucometer machines, weights, scales, and ECG machines, which can do checks and send this information remotely. Yes, the benefits of telemedicine are real. It can offer a cheaper way to access healthcare. There is the reduced cost in terms of transportation, the cost associated with loss of time. There is the removal of the whole location, space, and time barrier. Telemedicine is not here to replace traditional medicine. It is here to augment and complement traditional medicine. So for us to think that, hey, telemedicine is one thing and in our in-house brick and mortar setup practice is another part of medicine and they're totally different and against each other, that's not true. Telemedicine is here to augment and complement, not to replace. I thank you for listening. Download the app. Hello?
Thank you, Dr. Kino. Wonderful presentation. Are you hearing me?
Yes, I am.
Okay. Telemedicine. I like that you put that into perspective, that it's not here to replace traditional medicine, but to augment and complement traditional medicine, because I don't think traditional medicine can be replaced, but certainly in this time and for the future, telemedicine does have a place, and it will be have a greater part to play in the care of our patients.
Definitely.
So thanks once more for that presentation. I see where our host, Sam Woolgate Solutions, has asked that the questions directed towards you be placed in the Q&A. So I'm sure he's going to instruct you to answer questions there. Probably sometime towards the end of the other session, you might be able to answer some questions directly. But in the interest of time, I'm sure that's why he's asked that those questions be placed there. But I just want to thank you for your presentation, and certainly at the end of this program, you'll be more formally thanked by one of our board members from the Caribbean College of Family Physicians Jamaican chapter. So thanks again, Dr. Forrest, and congratulations on a wonderful presentation.
Thank you.
We are going to move on, right, Sam? We're going to move on to our next session, and that's the ethics session. And we have two presenters. We have two presenters, Dr. Well, no, not any more doctors this evening. We have two gentlemen who will be doing the ethics section of this evening's presentation.
And they're online. It's Mr. Cameron and Mr. Forrest.
Mr. Forrest. Let
Right.
me just quickly introduce Mr. Cameron first. And I note, Sam, that you did not attempt the pronunciation of his first name. I will not challenge it either. Mr. Cameron, attorney at law and founder at Design Privacy privacy consultants offering data protection services, host of the Design Privacy Weekly podcast. An experienced attorney, 21 years at the bar, a history of working in regulatory compliance in the telecom and financial industries, is skilled in privacy law, commercial law, and administrative law, among other notable cases. I think Sam is sending me a message, but I'll complete the presentation, the introduction to Mr. Cameron, and then we'll go on to the sponsors presentation in this life sciences, which will come just before the ethical presentation of this telemedicine. Since I've started with Mr. Cameron, let me just complete it, Sam. Thank you. In 2004, received a master's in information technology, and in 2019 completed an advanced master class training as a data protection officer. His primary focus is now in design privacy, as I said before. He's co-founded 2 technology companies, Jamaica UAV and also Ready TV. And he has another aspect to his portfolio. He's also a triathlete, and he's a co-founder of TriLife 876, and has actually participated in the Ironman triathlon in Augusta, Atlanta in 2019. So digest that for a little while. Our attorney at law, Mr. C. Cameron. And he will, of course, be joined with Mr. Trevor Forrest. But as Sam hinted to me, I'm going to allow Indus Life Sciences to do our sponsors presentation just before the start of the ethics session. And once they complete their presentation, I will continue with the introduction of Mr. Trevor Forrest. So Indus Life Sciences, Mr. Daya?
Yes,
sir.
yes, doctor. Good evening. Good evening, doctor. Good evening to all the participants of CCFP, to the panelists, and as well as the presenters. I am Daya from Indus Life Sciences. Thanks for this opportunity to come on board on this ethics meeting. So we have a couple of products. I thought I can just refresh them. Mr. Sam, can I share my screen?
Yes, Mr. Daya, definitely.
Thank you. So I have a couple of brands which I thought I can just refresh for the doctors who are being detailed these products for quite some time by our med reps. So Indus Life Sciences, basically we are at 3 Carifta Avenue, Kingston 11 on the Spanish Town Road. So we have some brands which are quite popular in Jamaica as well as in other Caribbean countries too. So one of our brand is our vaginal insert. This is for treatment of bacterial vaginosis, trichomonal vaginitis, candidiasis, as well as mixed vaginal infection. And we introduced it in 2015. And today, Dresvi is #1 prescribed among the combination inserts. And thanks very much for the medical fraternity for making it #1 brand. And Dresvi is a combination of the antibacterial metronidazole with miconazole for yeast infection. And this is the first formulation which has been introduced in the Caribbean market in a gel formulation. Before that, the similar combinations were available, but they were either in the form of tablet or in the form of pessaries. But Dresvi is the first brand of the similar combination was introduced in a gel formulation. The benefit of the gel is the gel has the fastest onset of action. When the patient inserts the gel with the help of the applicator, the onset of action kicks in less than 5 minutes. And another benefit with the gel is that the compliance is much better. The treatment is just for 5 nights. Normally, if it's a tablet, it goes as much as 10 nights. And the pessaries is normally recommended for 7 nights, but the gel is for 5 nights. So the compliance will be way better compared to tablet or pessaries. And also, we first brand is Dresby that has been introduced with 5 applicators. So that makes it more hygiene. And the patient has to just fill the gel in the applicator and have to insert and then push the gel inside. So there is no need to use the same applicator every night. Rather, they can use a new applicator every night. So that makes hygiene, is very good for the patients. And the dress is globally acclaimed, is available currently almost more than 30 countries, especially in Caribbean market. It's available, of course, Jamaica. It's also very popular in Cayman and Bahamas. And we are in the process of introducing it in Guyana, Barbados. Most probably before end of this year, we'll be introducing it in Guyana and Barbados also. Plus also available in Africa and Asian markets too. And we have another interesting product. As we are in the hurricane season, a lot of patients may have symptoms of cough and cold, or even flu also. Of course, the COVID also have a symptom of flu and cough and cold. So productive cough, especially when your patient has a symptoms of bronchitis, COPD, asthma, or respiratory tract infection associated with wheezing. So you could depend on or Viscofes, which is a right combination of 3 active drugs. They work in synergy. One of the drug is ambroxyl, which is basically a mucolytic drug. It breaks the mucus. And the other drug is salbutamol. The role of that, it opens the airways. And the third one is guaifenesin, which is basically helps to expel the sputum out. So breaks, opens, expels. That's how they work. The ambroxyl breaks and the salbutamol opens and the guaifenesin expels. So they work in a very synergistic way. And ambroxyl is found to be very good, especially it helps to clear the mucus at the level of the alveoles. Therefore, it helps for easy breathing, especially patient has difficulty in breathing because of the cold, and it helps them, eases out that. And it has 2 milligrams salbutamol in each 5 ml. So it's normally recommended for adults 5 mils 3 times a day. There's no need to give 10 mils because it has 2 milligrams salbutamol each 5 mils. The pack is 100 ml. So if you're giving 5 mils for 3 times a day, the 1 pack of 100 ml will almost last close 7 days. So viscough or viscous cough or viscous cough, yes, is nothing but salbutamol. The dose for kids is of the dose, that is 2.5 mils is the recommended dose for kids. For 2 years and up to 6 years, it is 1.25, 6 to 12 is 2.5, and about 12 years, it is 5 mils 3 times a day. That's the recommended dose of Viscofes. And apart from Viscofes, we have another good product, which is for allergy, because especially with the pandemic, we tend to wear the mask almost, more than 10-12 hours also. So sometimes it itself will induce cough, and the weather is inconsistent, rain and shine, so it may cause flu, and so many other factors are there. So we have a 2nd generation antihistamine, which is fexofenadine. We all know the 1st generation is DPH, so it's still very good antihistamine, no doubt about it, but has its own pitfalls. Like it has sedation, it has anticholinergic property like dryness of mouth or blurred vision, all those things. The benefit of the 2nd generation, it has least incidence of sedation, or it is also termed as daytime antihistamines. Means this antihistamine will not cause any sedation, even for people who do the critical job like truck drivers, those heavy vehicle drivers, or people do electrical job. They can still depend on the 2nd generation, as because it does not cause any drowsiness. It is recommended for allergic rhinitis, skin allergies like urticaria, as well as angioedema, and other cold and flu induced allergy. Other conditions it can be recommended. It is once a day. That's the benefit of the fexofenadine, and our brand is Fexil, Fexil, Fexil. How we coined the brand name is very simple. Fix it, fix the allergy with Fexil, fix it with Fexil. That's how we coined the brand name. So it's ideal for seasonal allergic rhinitis, skin allergy, and other conditions also. And most cost effective, the 120 milligram per tablet is around $35 is the pharmacy price, and the 180 milligram is around $55 per pill, which is the most affordable fexofenadine in Caribbean. The brand you all know, I'm not going to bash the brand, is almost 5 times expensive than this per pill. And we have another interesting drug for pain. So it's a gel basically for any of your patients, has symptoms of knee pain or suffering from wrist pain, back pain, neck pain, shoulder pain, arthritis pain. So for them, we have one-stop solution, which is Capsitop. As a brand name must have definitely given a clue. Capsitop is basically capsaicin, topical applicant Capsitop. As capsaicin is nothing but it's the extract from capsicum that we eat, pepper. So it is found to be very good in depleting pain by inhibiting substance P. And this capsaicin is even approved by US FDA for chronic pain like neuropathic pain. It is approved by US FDA. And Capsitop, apart from capsaicin, it has other 2 more ingredients. One is the diclofenac. So we all know diclofenac is a very potent, drug to reduce pain. It depletes pain by inhibiting the pain mediator prostaglandin. And also we have methyl salicylate, which is also depletes pain by counter pain mechanism, as well as it has a role in depleting the mediators like interleukin 1, interleukin 6, like that. So capsaicin has got 3 active drugs. That's why we call a SWAT team. They are specialists. 3 specialists work together to combat pain. Capsaicin by inhibiting substance P, diclofenac on prostaglandin, methyl salicylate on interleukins. So when the pain is moderate to severe, so you can definitely depend on Capsitop. It's an over-the-counter product. There's no need for prescription. It's a 30-gram tube. The only caution is that please recommend your patient not to do aggressive massage. Recommend your patient to just apply gently, because it has capsaicin. Few of your patients may even complain of his burning, and some may appreciate it. We got the feedback. Some of them say they like it because it gives heat and they feel it is working. But some says, it's burning. So as a precaution, better a little gentle spread is sufficient, 2 to 3 times a day. And obviously after applying, they have to wash the hands thoroughly, not in contact with the eye or any other private parts. Capsitop is a pain rub. And the last, just before we have a 3-minute slide, I will just come to that later. So we have introduced just recently, around 2 months ago, interesting ophthalmic product. This is ideal for all specialists basically, because one is basically for dry eyes. It's a lubricant, as we all spend too much of time, on webinars, and as well as kids also, they spend too much of time on the online classes. And social media is one of the things we spend too much of time to, like mobile and stuff like that. So dryness of eye is there, dry eyes are there. We have a nice lubricant, which is from Indus, Celdus, which is our brand of carboxymethyl cellulose, which is recommended for dry eyes. So this is over-the-counter product. There's no need for any prescription. We have in 2 strength, 0.5 as well as 1%. 1% is a gel formulation and 0.5 is a solution. The gel works longer hours, almost for 24 hours. It works. That is Celdus. How we coined the brand name is that the name of the organization is Indus. The company is Indus Pharmaceuticals, which is basically I and us, Indus. I and us together serve the community. I and us, Indus. So we took dust from Indus and the active drug cellulose. Cellulose, Indus, Celdus. That's how we coined the brand name. And for infected eyes, we have ciprofloxacin drops, which can also be recommended for ear infection also. Ciprodus, again, ciprofloxacin from Indus, Ciprodus is available. But tobramycin is recommended for infections, eye infections. Tobramycin, Indus, Tobradus, and we have it combination with immunosuppressant, which is dexamethasone, that is Tobradus D, is also available. So this all ends with DUS, so you can easy to remember the active drug with the Indus DUS. Tobradas D is with dexamethasone, Ciprodas is ciprofloxacin from Indus. And the benefit of these brands is that cost-wise, they are the most affordable currently. I'm not bashing any brand, just giving a little information. For example, for dry ice, we have the Celdes. So you could see the cost per pack of 10 ml, the 0.5 is around $392. We could see the brand, which is $1,218. We are very good, affordable, and we are bioequivalent also. So we have the 1%, which is the Celdes 10 ml, which is $540. The brand is almost close to $1,500. Similarly, the Tobradas and Tobradas D is respectively $274 and $687. And ciprofloxacin drops Ciprodas is $306, whereas our competitor brands at least 4 to 5 times expensive than our brand. So we have other couple of glaucoma products which have not presented it because I understood it's mostly with the ophthalmologists recommended. So these are ophthalmic products. So this is my presentation on slides. And Mr. Sam, I'm just going to share the 3 minutes video of AminoPep. Can I go ahead? Mr. Sam?
Hey, so sorry about that. I think I was up to Dr. Dane. I think we're about 3 minutes over already.
Oh, really?
I'll tell you what, yeah, let us move on to our presentations, and then at the end, we can allow you to play that video at the end.
Okay, sir. Okay, Mr. Sam. Thank you very much.
No problem. Thank you.
No problem.
Thanks, Sam. I think that was a wonderful solution. Thanks, Mr. Dea, for your presentation. Indus Life Sciences is actually sponsoring this session of the webinar, the ethics session. And our two presenters, which are Mr. Chukwumika Cameron. I think I got a bit of courage to attempt that name. I did already introduce him, attorney at law and founder at Design Privacy, also co-founder of Jamaica UAV and co-founder of Ready TV, and a triathlete to boot. I just want to, before I go into introducing Trevor Forrest, which will be our co-presenter for this session, just to remind our participants that CMEs will be granted. 3 hours of CME will be granted. Once you register and participate, you can be assured that your, thanks Sam, you can be assured that your CMEs, you're assured of your CMEs. So this session is the ethics session. Mr. Chukwumika Cameron and Mr. Trevor Forrest will be our presenters. Trevor Forrest has more than 29 years of experience in the IT industry. Trevor Forrest's service in the local ICT industry has demonstrated a commitment to driving improved standards of ICT adoption across the private and public sector, where he has consulted on the design and evaluation of numerous ICT projects and digital transformation strategies. He's also well known for evangelizing the adoption and use of open source technology across the public and private sector, as evidenced in his social media tag, Mr. Open Source. After 15 years in the United States, where he occupied various management posts in IT, Mr. Forrest returned to Jamaica in 2006, when he founded 876 Technology Solutions, a provider of comprehensive open source based technology solutions serving the Caribbean market. Mr. Forrest has served in the Jamaican government as a senior technology advisor at the Ministry of Science and Technology, where he spearheaded many groundbreaking government policy initiatives. Mr. Forrest was integral in the establishment of the Government of Jamaica online portal, gov.jm. He also had oversight of the public-private partnership between the government and telecommunications providers to establish a zero-rated access to all government online services. He has served on numerous ICT groups and committees, which I will highlight a few. He's chairman of the Spectrum Management Authority, chairman of the UTech School of Computing and IT Graduate Studies Advisory Board, chairman of the National ICT Advisory Committee, and also founding director of the Jamaica Information Technology and Services Alliance. He's a blockchain enthusiast, and he's a graduate of Jamaica College and also Embry-Riddle Aeronautical University, where he attained a Bachelor of Science degree in Aerospace Engineering with a minor in mathematics. A family man, avid music producer, and disc jockey, and enjoys downtime with his family. So my audience, my panelists, our participants this evening, I'm sure these two men will ably take us through this final session of our webinar, our ethics session, ethical considerations in electronic record keeping and management. I give you Chukwemeka Cameron and Trevor Forrest. Gentlemen, the screen is all yours for the next 30 or 40 minutes. Thank you so much and good evening.
Good evening and good night to all. I can assure you that the challenge of pronouncing my first name is not as hazardous as that great challenge you see going around. There are no negative side effects even if you are to fail. Maybe a little blood coming from the tongue, but that's about it. So we have 15 minutes, and I'm going to first ask everybody, what does that machine look like? I have heard when I've asked this question before that it looks like an old sewing machine. So nobody can do worse than that. So if anybody just cares to throw in the chat what comes to mind when you see this machine, that would assist the presentation. Just 10 seconds, and the first thing that comes to your mind. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so we got a few good answers. Abacus, polygraph, got a few good answers, quickly strolling through them to see. Guillotine, yes, that bar does look like a guillotine. Okay, so what this actually was.
Switchboard.
Well, so what this is the original IBM, the precursor to the Turing machine. And for those technology enthusiasts, the Turing machine was the earliest form of the modern day computer. So this was a precursor to it. This was the machine that Hitler used, the Hollerith machine, to process the data collected from the census that he conducted in 1930. After having conducted that census, he used this machine to process the information because the information was actually captured on punch cards. Having processed the information, he was able to generate lists of all the Jews and all the migrants that were in Germany, and we all know what happened next. These lists were given to the army people that a special name for them that I don't remember. And then they were then hunted down and put in concentration camps. And then we had the Holocaust. At the end, in hindsight, or after it was brought to an end, all the European nations came together and tried to determine what were the enabling factors that facilitated such an atrocity. And after examination, they realized that it was actually one of the great enabling factors that allowed this mass scale atrocity was the processing of personal data using technology. And this was cutting edge technology in 1930. So this was a special project taken on by IBM. It was when having reached that conclusion, they said, okay, so if processing of personal data en masse was an enabler, how could we prevent such a atrocity again going forward? And it is from this event that gave birth to the right to privacy, and more specifically, the right to informational privacy, because there was a clear association with the processing of personal data and life and death. So one of the factors to prevent such an atrocity was to protect that personal data of their citizens. And they said, never again would any state agency or private entity or doctor or lawyer or any third party have the ability to process data unlawfully because we are going to protect in data. So between 1930 and today, there are a lot of consultations, conventions, agreements, and the most relevant one and the most far-reaching one was a directive in 1995 that said that on the protection of individuals, well, it required the protection of individuals with regard to the processing of personal data and on the free movement of such data. So this is where the European Council passed a law saying all European countries must now implement these laws that protect this right to privacy. This then impacted upon us in 2008, where the European government said, okay, guys, in order for us to do business with you in this economic partnership agreement, and you'd remember this was after all the quota, the free quotas and tariffs that we enjoyed with the banana and the sugar were challenged and overturned, and they found a new way to engage us. They said a condition to that, however, is that if we are going to be sending you our citizens' personal data, you must protect it and demonstrate to us that you can protect the personal data that we are going to be sending you. And fast forward to 2018, now we have the GDPR. That's when it was actually implemented. That is when they say all countries now must implement the exact same law. Because what was happening with the 1995 directive were that countries had the opportunity to implement their own version. Now they said everybody must implement the exact same law. Fast forward to today. Why did Mr. Cameron start talking about the Holocaust at 8:26? Because when we fast forward today, we are aware, and the health sector is also at the cutting edge as well. The government of Jamaica is on a quest to transform our society digitally. And one of the enabling factors or pillars upon which we are trying to build this digital society is the needs identification system. And that is to provide the safe, reliable, and robust verification and authentication of identity information for citizens of Jamaica, thereby allowing for the strengthening of identity security, cybersecurity, and the simplification of bureaucracy. When the government sought to implement this needs bill, the opposition objected to it. And they said, this is unconstitutional. This violates the right to privacy of our citizens. They said, because the mass collection of personal data of our citizens and the mandatory nature of it as well is unconstitutional. Question for all of us. Does this activity, the mass collection of personal data of all our citizens, remind you of anything I just shared with you? Does it sound in any way similar? Might it sound in any way similar to the mass collection of personal data that the German government undertook in 1930? Well, if it does sound familiar, the reason why it does is because it is the exact same exercise, the mass collection of personal data. In 1930, it was done for a lawful purpose, and that was to conduct the census. However, it was used for an unlawful end. Similarly so, the government has a lawful purpose to collect this data, but the opposition said there is nothing in place to prevent the abuse of this data. And our constitutional court actually agreed with the opposition and said it is a right to our right. It is a right to a breach of, it is a breach of our right to privacy. And not only is it a breach of our right to privacy, it declared a constitutional right that we now enjoy. And that's the right to informational privacy, where none other than our Chief Justice said, informational privacy, which does not deal with a person's body, but deals with a person's mind, and therefore recognizes that an individual may have control over the dissemination of material that is personal to him. Unauthorized use of such information may therefore lead to the infringement of this right. So again, we must be asking ourselves a question. Well, this is an ethics session. Why are we hearing about the Holocaust and what the Constitution or court said? So if we're to step back and think about this duty of ethical duty of confidentiality that you owe to your patients has now been escalated to a constitutional right. So it's no longer a question of professional ethics that we as lawyers owe to our clients. It's no longer a question of professional ethics in your sphere that you owe to your patients. You now have a constitutional obligation to protect the personal data of all of your patients. That is the association between one and the two, both of them. Having said that, when we look at this picture, this is a cartoon of police coming to your house 8:30 in the middle of the night under lockdown, kicking down your door, searching your house without presenting you with a search warrant. If it is, I were to ask you, do you think this is a restriction of your right to privacy and unlawful? Yes or no? What would you say? Quickly, 5 seconds so let me ask the question again. If it is, police came to your house 8:30 at the night during lockdown, kick off your door without saying anything to you and start to ransack the place searching for something, do you think your right to privacy would have been restricted and would have been unlawful? 1, 2, 3. I just dropped out for a second. Sir Trevor, are you here?
You're back now, you're back.
Yeah, you're back now.
Yes, so I shouldn't talk bad about the police that have these powers now. And Mr. Forrest help them to have these sort of powers. Trevor, I'm sorry. Right, so yes, it would have been a breach of your right to privacy, and they would dress up in a different color uniform and present a warrant to you and say, we're here to conduct a search. And then conduct a search. I'll ask you the same question. Do you think your right to privacy would have been restricted, and whether or not it would have been lawful or not? what would your answer be? 5 seconds to drop a yes or no. Yes, I mean 1, 2, 3. Like somebody asked for me to repeat the question. If police were to come and present a search warrant and then conduct the search, having gone to court, a judge issue the search warrant under the powers, the laws that are available to him, issue the search warrant and conduct the search. Do you think your right to privacy would have been restricted, and do you think it would have been unlawful? Nice. Shanique, who is Shanique Graham? Shanique Graham. You get to move to the front of the class. A lot the answers are coming in very quickly, but I saw Shanique Graham say, yes, my right to privacy would have been restricted, but it would have been lawful. Perfect. That's a perfect answer. And you're 100% correct. And why do I use this example? Because that's the exact same position that we are in today as doctors. If you have any personal data in your possession whatsoever, today you are restricting their right to informational privacy. If you have any personal data without their authorization, so you are no better than a potential scammist. And those sound like some hard, offensive words this late in the night, but there is a legislation that was implemented to fight this whole issue of scamming, where the law said, if it is police who are to come to your place of abode and find you with a list of names of foreigners with contact details, and you cannot explain why you're in possession of in this list, it would have been a criminal offense. You are now in the same position. So what the Data Protection Act has done, the Data Protection Act has said, okay, right now you're breaching everybody's lawful right to privacy. This is how you do so in accordance with the law. If it is you follow these data processing standards, while you will be restricting their right to privacy, you will be doing it in accordance with the law. So the Data Protection Act does 4 basic things. It first breaks down and sets out in particular what those, when I use the word informational right to privacy or informational right to informational privacy, what are they speaking about? So it sets out what your rights are. It also sets out very clearly what it is you as a data controller, what you as a doctor must do to be able to lawfully process persons' data. It also tells you that you must also put systems in place to enable data subjects to exercise their rights. And then it creates a supervisor authority to ensure that you are indeed doing this. Rest assured, so I have 40 seconds left. The medical profession processes the most sensitive personal data. Design privacy has been following all the decisions of all the information commissioners around the world, because the world has only recently implemented a similar type of Data Protection Act. Cases against or complaints and decisions against the medical fraternity rank in the top 3. So even today, we don't think there's an association with the Data Protection Act and ourselves, but rest assured, it speaks specifically to your industry and your profession. And the first thing you are required to do in parting to bring yourself in compliance with the legislation is put yourself in a position to register with the Information Commissioner. So no one is going to be allowed to fly under the radar. If it is you do not register with the commission once it's established, that is a criminal offense. And you understand why it's a criminal offense when you go back to 1930 and where it's coming from, and the fact that we're now speaking about a constitutional right and it's no longer just a question of ethics. You can now go to jail if you do not even register. The process of registering is very engaged and is at bare minimum an 8-month to a 12-month process to put yourselves in a position to register. as persons processing sensitive personal data, you are also required to appoint a data protection officer. At this stage, I'm going to hand over to Trevor. Thank you very much. And he will speak to, remember I said there's some data processing standards that you must comply with. Well, there are 8 data processing standards that you must comply with. The 7th data processing standard is that you must implement certain technical and organizational measures. Trevor is going to take you through some of those technical measures that you must implement. Trevor, over to you, and thank you very much for the opportunity to share with you at this forum.
All right, thank you, Chuck. So what I'm going to do is going to highlight a couple of things. I will say the advent of the data protection legislation was, almost like a watershed moment. I was fortunate enough to participate very closely in the passage of that piece of legislation while I was at the ministry.
I don't interrupt, Trevor, but it's your fault.
You know what? I'll accept that. I'll take it. I'll take all that blame, right? So, but what I kind of want to do, actually, Chuck, before I start, could you just do one more thing for the audience? Could you highlight for them what the penalties are if they were to breach the data protection legislation?
Okay, so I don't need to go the scare tactic because it usually paralyzes people. But Trevor,
I think they'd find it interesting, and it would segue really well into what I'm going to.
On your request, sir.
Yes.
So I'm going to speak about the monetary penalties last. The Information Commissioner has the power to tell you to stop processing personal data. This is not a tribunal, this is not a judge, this is not a body of medical doctors that are reviewing your work, determining whether or not you are professionally negligent or not. If it is you're in possession of personal data and he finds that you have not complied with the data processing standards, he can lock down your practice until you put the appropriate controls in place. Secondly, he can, well, if you don't register, so we're not even talking about putting controls in place. If you do not register, you can go straight to jail. You do not pass go, you do collect $200. And then now, what people mostly talk about are the monetary penalties. And this is where you can be charged up to 4% of your gross profits. So there's real teeth behind it. And again, when you put it in the context of the constitutional right and where it is emanating from, get a greater appreciation why it is viewed as critical to the protection of our dignity today and going forward in the future. So Trevor, over to you. The path has been clear. They should be very receptive to you now.
Thank you, sir. So what I'm gonna attempt to talk about here really is the stuff that would be of concern to most people. So now you know that, boy, if you don't put certain things in place, ordinary supper. We kind of talked about what my company 876 Technology Solutions does. Among other things, we do data and information security consulting and solutions. And we do that through a host of partners that we have. When it comes to electronic health records, one big issues, especially as it relates to compliance with data protection laws, there's some security issues that you always have to take into consideration. And of those issues, there are about 4 things that you really need to pay attention to: privacy and confidentiality, which Chuck has talked about; the accuracy of data and integrity of the data that you have in your possession; you're going to have to be concerned with security breaches, because if you're in possession of data and that information is stolen or misused or so on, and that doesn't necessarily have to come from outside, it can come from inside, because some of the biggest threats to businesses from a security standpoint come from inside. They're insider threats. You have to be concerned about that. And, you know, encompassing all of this, through the use of technology, you have to really pay close attention to the systems, the IT systems, and how they're implemented in order to ensure that you are in compliance from top to bottom with all of these requirements and these priorities. Now, I'm gonna do a check on you, and I'm gonna ask you. I'm gonna give you some industries, and I want you to guess in the chat which one is perhaps the most breached industry globally. So, all right. So, you know, since we're talking healthcare here, I'll start with the healthcare industry. Then we have the financial industry, the technology industry, the retail industry, government. All right. So that's 5. All right. So government, technology, retail, financial, healthcare. You guys want to just, you know, take 10 seconds and hazard a guess as to which one is the most breached globally. Right. So I see financial, I see government, I see health, I see financial, I see retail, government. Overall, all right, your 10 seconds are up. So overall, we're seeing a lot of government and finance, right? And that kind of makes sense, right? Financing industry is where the money is. It's where people would go, and government has a lot of data about people, right? Okay. How about that? Healthcare between 2018 and 2020 trumped the financial industry and completely obliterated government as it related to global data breach security threats. Now think about that for a second, as the Minister of Health said some time ago. Let that sink in, right? Your industry is the biggest target for data breaches, right? So what does that mean? All that stuff that's been outlined in the data protection legislation and all of that kind of stuff, and all of those interesting fees and measures that can, you are the top target, and the eyes are going to be on you when that stuff goes into effect, right? So what I kind of want to talk to you about is, how do you ensure that the information commissioner, when you know this law goes into effect, doesn't run in on you and say, yeah, you're not doing things right, because your patients are complaining that they don't feel that you're treating with their data very well. So how do you protect that stuff, right? So what I'm kind of going to go through really quickly, because you know time is upon us, is how do you protect business against the kinds of attacks that would occur that would cause such a breach, right? So the first thing is, and you know, I guess some of the psychiatrists and so on would say, just acknowledge that you have a problem, right? So it's not a matter of, you know, if somebody is going to try to breach or steal your data. It's a matter of when. It's gonna happen. So first you just have to accept that the fact that the breaches are gonna occur. What you have to, and that's fine, because even if breaches occur and you can demonstrate that you've put certain measures in place to mitigate or even minimize those, you're not in a bad position. So first of all, just accept breaches are gonna occur. So both yourself and even people who work for you, you want to make them aware. You want to send them to training. Yourself go to training and make yourself aware about cyber threats, right? Breaches and that kind of stuff. And the other thing that you want to do is to really understand the risk to your business, your practice, because again, many of you, you're perhaps a 1 or 2 person practice. Some of you are bigger, but the fact that a single entity can walk into your practice and say, because you haven't done these things, you can't function anymore, is a serious risk. So one of the key things that you have to do, and this is the kind of stuff that we do, that Design Privacy does, is to assess the risk to your business, and also in doing so, do an overall security or information security assessment. What that does, it allows you to get a clear idea of where you are and where you need to be, and what you have to do to get to where you need to be. All right. And in doing so, you start to see the important things that you need to do within your business to ensure that you're compliant with these laws and regulations. One of those major things is ensuring that you have good backups of information that you're storing about your customers or your patients, right? But to do that, obviously you have to have some sort of plan. Now, it's not reasonable to expect that you as an expert in your field of medicine would know how to do something like this. And that again is why we're here talking to you, because that's the kind of stuff that Design Privacy at 876 Solutions, many other entities out there, T-Tech, SimTai, and all of those companies. That's what we do to help you to get to the point where you are in a position to be more compliant from a technical standpoint with what these laws and so on require of you. So when it comes to protecting your computers, protecting the data on your computers, installing all the systems that need to be in place to protect the data that you have for your patients to a level that not only makes them get the warm and fuzzies, it gives you, a certain degree of confidence, but it also gives the gatekeepers of that, which is the Information Commissioner's Office, it demonstrates to them that you have done what you need to do at a technical level to get the data of your patients, the health records and so on, to a point where it is secure, safe, reliable, accurate, and so on. So these are the things that you want to do. You want to have a plan. You want to do assessments to see where you are. You want to implement different solutions and platforms to make sure that you protect the information that you're in custody of, because this information is extremely valuable. It's very sensitive. And if you do not demonstrate that they have done enough to protect this information, then dog name is up, literally. So a couple other things that you want to do is, and sometimes you kind of take this for granted, right? But you want to control access to critical systems within your office. Now, sometimes, and I've seen this and I've observed this in different profiles, whether it is consulting or just visiting a doctor's office. But a lot of times, your staff and even some of the doctors are very loose with how they conduct themselves around their computers and so on. So, a patient might be sitting in your office and you're working on your computer and somebody calls you, just get up and go outside, and you go out for about 5 minutes and you leave a patient in your office and your computer is turned on, logged in, opened up to a screen in an application that has access to a whole bunch of personal data. Now, if I was a nefarious actor, I could jump on that machine and I could just stick a jump drive in, download all that information, and you would never know. You don't want to do that, because now you have just facilitated a data breach, and it didn't really take me a lot of work to do that. So one of the things you want to do, you want to make sure that you have, again, awareness and practices in place, both yourself and your employees, of how access to your computers is gained. Protect, lock your computer screens whenever you step away from them, and this should be done across the board. It should become a matter of nature within your organization, within your practice, so that whenever you are in an environment where you have data, sensitive data about somebody, and external people, aka your patients, in close proximity to that there are ways to limit their access to that kind of information, right? And you do this in various ways, creating individual accounts for employees. So only employees who have access to certain things can see those things. You also want to ensure that employees, when they leave, access that they had is removed, so that malicious attempts to gain access to that data, or even to destroy that data, cannot be used or done. In fact, this is a very new approach that many nefarious threat actors are using, where they try to engage disgruntled employees to gain access to systems within different businesses, so that they can do interesting things. Many of you may have heard of this thing called ransomware and so on. This is now one of the new ways that ransomware finds its way onto your computers and your network. Insider threat, right? So again, it's not a matter of if a breach is going to occur. It's a matter of when. All right. And one of the things I just want to kind of point out, because sometimes we're not aware of what to do if we discover that something happened, if we discover that we've been a victim of ransomware attacks. And so what do you do if a breach occurs? There are three things that I really suggest that you do. One is to call your IT service provider, right? So that they can really take a look at what has occurred. If you don't have one, get one, because one of the responsibilities now, if you're going to start to use technology, is you're going to have to resource yourself to do that. Now, that doesn't mean you have to have somebody on staff. There are many service providers that can act as your IT shop, but they don't have to be a permanent employee. So you can outsource that kind of stuff. The second thing is to report the suspected activity to the Jamaica CERT. Now, the CERT is the Cyber Incidents Response Team. You can go to the CERT website, which is cert.gov.jm. And their contact information is there, or you can file a report at that site. And they will, in some instances, contact you. And as the data protection legislation and so on comes more into effect starting next year, the role of the CERT will mature. And the last thing that you can do is to report it to the police. Now, the police, believe it or not, actually have a cybercrimes unit, right? It's the CFCD, Cyber Communications Forensics and Cybercrimes Unit. They actually can assist you in determining what your course of action needs to be should a breach occur. And when the investigations have to take place, they're the ones that typically will do that for you. All right. So these are a couple of the things that, I kind of wanted to just put out there. I mean, time was short, but I really hope that this kind of helps to give you some idea of what you kind of need to do, some of the things you need to consider. And as always, if you need, you know, help, there are providers of that help out there. Design Privacy, 876, we really help you, and contact information is there. Feel free to contact at any time, and we can look at how we can help you to get to a point that you are securely treating with personal information, which has become so important that the legislation now ensures that the rights of the citizen and the data that you have on them is upheld. All right, that's my more than 2 cents. Again, I hope that this really compressed presentation has kind of elucidated things for you. And feel free to, you know, hit us up at any time, and we'll be happy to answer any questions of this nature that you have. All right, so that's it. Dr. Levy, back to you.
Thank you, Chuck. Thank you, Trevor, for those most informative presentations. I am going to ask our host, Sam, will you allow a few minutes for question and answers, please? Sam?
Wonderful presentations. Thank you, Dr. Levy. Thank you guys for your presentations. And pulling out that retro image of the first, I don't even know if that's a computer or a data analyzer that Hitler of all persons used to set his history. Wonderful, informative, interactive presentation. So ladies and gentlemen, it's over to you, right? These were wonderful presentations, very informative. I don't know if you have questions so much as you guys had some before. I think Chuck answered a few of them by typing the answers. Are there any questions? Any questions, please put them in the Q&A. All right, so Dr. Pauline Williams-Green is asking, hi, Doc. She's asking, does the data protection law cover paper clinical notes? Interesting.
So the data, if I may, Sir Trevor, the Data Protection Act covers all personal data in whatever format it is. If it's in your phone, if it is in your diary, physical diary, or if it's on a box under your receptionist desk, or if it's contained in an X-ray, in a X-ray that was just done.
Fair enough. All right, so great answer there. And ladies and gentlemen, if you want to ask your questions, maybe it's too much to type, you can raise your hands using the raise hand function, and I can allow your microphone to go active and you can speak to the gentleman and ask the questions. Dr. Williams-Green says, thanks, that was clear. She understands. Any other questions?
Sam, I think Marvin has a question.
Prof. Marvin Reed, do you have a question? Please go ahead.
I don't have a question.
Oh, okay. I thought there was some indication from you.
I think Prof. Reed, like myself, really enjoyed this presentation. He's a low-key techie. I'm not sure if he chose medicine before technology or it's like symbiotic, but I think he enjoyed the presentation.
Okay.
So guys, I think everyone enjoyed the presentation. I think you guys are so wonderful and good at what you do. You leave people without questions. So look, you know,
probably we're all in a state of shock.
Yeah, this is what happens when you're so excellent.
Yeah, that might be
it. This is one of your penalties for your excellence. Thank you guys so much for your presentation. Dr. Levy, back to you.
Okay. Thanks, Sam. And to formally thank everyone who participated in this webinar this evening, I ask Dr. Arlene Henry Dawkins, one of our executive members of the Jamaican chapter of the CCFP, to so do now, to just formally thank everyone that participated. A wonderful evening, very, very informative. And we have the most able person to thank everyone. Arlene? can you please go ahead and do the vote of thanks for us? Thank you so much, gentlemen.
Good afternoon, everyone. I am Dr. Arlene Henry Dawkins, and I have the great honor and pleasure this evening to deliver the vote of thanks as we bring today's seminar on electronic record keeping, telemedicine, and ethics to a close. We trust that you have found it very informative, useful, and pertinent in planning and executing your protocols to protect patient information when records are kept electronically without the patient being physically in your presence. As the only speaker left between you, your CME certificates, and the well-deserved rest after a long day, I will try to be remembered for my brevity in delivery. First, we would like to thank Dr. Kino Francis, Chief Medical Information Officer, for his very interesting presentation on telemedicine in the New World. Mr. Avinash Saxena, CEO, Pharma, for his innovative insights on electronic record keeping, and Messrs. Chuck Pamika, Cameron, Attorney at Law, and Trevor Forrest, CEO, 876 Solutions, for their excellent, informative presentations on ethical considerations in electronic record keeping and telemedicine, on processing and protecting personal data. We value all the points in the presentations, and ones that resonate a lot to us tonight are these. The connectivity of the healthcare providers with their patients is paramount, and many avenues for this virtually are being developed rapidly, especially during this COVID-19 pandemic crisis. Telemedicine is one such, which is here to augment and complement traditional medicine, as impressed on us by Dr. Kino Francis. It's a constitutional right for us as health practitioners to protect the personal data of our patients. We must become knowledgeable of the rights under the Data Protection Act laws and be compliant to avoid criminal prosecution. This is absolutely critical for practice as health providers. I'm sure we all took note of that one. Next, we would like to thank Professor Marvin Reed for leading us in the opening prayer. Dr. Seni Onanuju, President, Caribbean College of Family Physicians, Jamaica chapter, for the welcome and the opening remarks. Dr. Dane Levy, our excellent moderator, for ensuring the smooth flow of the sessions. Our sponsors representatives, Mr. Garth Russell of Pharma Online Daisy Health, and Mr. Dana of Indus Life Sciences. We trust we can continue our partnership with you for future sessions. They have all made significant contributions to today's proceedings, which generated vibrant discussions throughout. We wish to thank our hosts, the Caribbean College of Family Physicians, for organizing and delivering another high-quality event. We must recognize our technical and administrative support personnel, Mrs. Lynn Thompson-Hyatt and Mr. Samuel Heron, for handling the registration, the coordination, the communication, and technology for this seminar. And of course, we need to thank all you attendees for taking time out of your busy schedules to attend and to participate. We wish to say a huge, huge thank you for all the priceless knowledge shared and learned tonight as we, the health practitioners, endeavor to efficiently navigate the multiple platforms in the virtual space with the ultimate goal of offering optimal care for all our patients in Jamaica and the wider global community. If anyone was omitted, we wish to give a general thank you to all those who were unintentionally overlooked. And so this brings today's session to a close. God bless, walk good, and stay safe. Good night.